I'd like to welcome everybody to the Medical Marijuana and Wellness webinar series. Tonight's topic is going to be ketamine, ketamine for mental health and wellness. I think this is a subject that's new to a lot of people. I know that ketamine is not new. It's been around for a while, and we have a gentleman who knows a bit about it, Turner Davis, who's going to explain some of the history. It's been used, especially within the VA hospitals, for a number of different treatments and very successfully. And I think it's helping quite a few people right now. And hopefully we can enlighten you as to what it is, how it works, and hopefully see if it's something that will help you with your particular medical condition. I'd like to introduce Turner Davis. Turner is with the New Horizon Infusion Clinics. And this is something you're kind of a new venture. You've been out for about a year and helping a number of people. Is that correct, Turner?
Yeah, no, we started, about almost, it's been 18 months now, doing ketamine infusions for patients primarily with treatment-resistant depression, anxiety, PTSD that has not responded to traditional therapy. It was, we originally started off with treating medical marijuana patients with our 20 clinics around the state, and then that helps a lot of folks, but some patients, we saw that needed even a little more help, or that maybe not didn't help them as much as they thought it would. This ketamine infusion therapy was a good progression, another good option for certain patients who really haven't, again, responded very well to more traditional or even an alternative treatment like medical cannabis. Some that are just battling something so severe they need a little more help. So,
Turner, I think you have a slide deck that explains a lot of things. Why don't you kind of dive into it and educate us on ketamine and how it works?
Well, sounds good. I will jump into it. All right. So again, thanks everybody for joining us tonight. Like Mark mentioned, my name is Turner Davis. I'm a pharmacist. Started off working with medical marijuana treatment clinics, working with physicians to qualify patients for medical cannabis, and we started researching and looking into ketamine infusion therapy for patients who haven't responded well to traditional therapies or those chronic mental health conditions that really people have struggled with their entire lives, and really been really looking for another way to another option to treat those. It can also be used for chronic pain. Ketamine infusions can be neuropathic pain. We'll get into that a little more in the presentation. But we have 2 clinics currently in Tallahassee and St. Petersburg, Florida. We do plan on opening more over the coming year or 2. But we started off slowly to get our feet wet and learn, and we have seen some really remarkable results. So let me get into the presentation.
All, I want to point out to everybody, if anybody has any questions, please hit the Q&A button that you're going to see right down in here. We'll be more than happy to answer your questions. This is not a lecture. We like to make this as interactive as possible and answer most of the questions that you have. And then what you're going to get at the end of this webinar is a follow-up email that has a link to the video, the YouTube video of this webinar, the presentation, and a lot of the notes that you'll see that comes out of this particular webinar. So you can actually not have to take copious notes. You can actually wait for that to come out, and we'll give you all the notes you need. But Turner, go back, if you don't mind, go back up one slide, if you don't mind, to the first slide. Next one up. Next one down. Yeah. Next one up. Yeah. But you had it. There you go. Now, a lot of people talk about ketamine, and what they're talking. Go down one more, if you don't mind. I think you're skipping. There you go, right there. A lot of people have tried to use a number of different alternatives, and I know that ketamine has come along and really helped with a lot of, you say, mental health issues like anxiety, depression, PTSD. I think just in general, people have had not just depression, but not just had this whole pall that's over them. And then what's really interesting is it also ties back to the whole pain, fibromyalgia, and migraine issue. This is something that really was researched and done a lot with the VA, wasn't it? Before these clinics started opening up?
Yeah, I mean, it was, the VA was one route, it was mostly done, and it really started with mental health and psychiatry offices. I'm not sure the VA was the leading researchers on it. there was an article, we'll get into that a little bit in the presentation, but there was an article in the Journal of the American Medical Association in 2014, rather, that really was sort of groundbreaking and presented ketamine as a effective treatment for some of these longstanding conditions that may not have otherwise responded. Originally, ketamine, like Marc mentioned earlier, has been around for many decades. It's typically used as a surgical anesthetic in much higher doses than what we use for the mental health treatments or the pain treatments. But it was synthesized to be an alternative to PCP, which, as we know, has a lot of side effects, obviously, and is now mainly a drug of abuse. It was the first FDA approved in 1976. But the really cool thing about ketamine, or what makes ketamine work outside of just anesthesia, is it has these three components. That it has a hypnotic, amnesic, and analgesic effect, and there's really no other drug available that has all three in one drug, essentially. So using different aspects of the chemistry of this drug is really what allows us to treat these varied conditions as far as pain or mental health, and what also makes it effective for those conditions.
Turner, I watched a movie the other night called The 13 Boys, about that in Thailand, those kids that were tied up in the cave. And I don't know if you had a chance to watch it, but it turns out that they had to put the kid, they had to basically anesthetize the kids in order to get them out. They had to take a journey it was a 5-hour journey underwater to take these kids out. And they wanted them kind of calm, and they used ketamine. I don't know if you knew that.
Yeah, no, I didn't know that, but yeah, no, that's very, very common in children. Ketamine is definitely one of the more popular anesthetics because it's one of the safest, and it wears off the quickest. It has very little residual effects beyond its initial use for anesthesia, at least anyway.
Yeah.
I had my dates a little wrong. I guess the JAMA article was actually in 2006, so it's been around a while. And really, these ketamine infusion for treatment-resistant depression, those things really got popular around 2012 or so. That's where we started to see clinics opening that kind of focused on this, and psychiatrists and other types of physicians making it available to their patients. Since 2006, work has been done with PTSD, anxiety, chronic pain, and migraine headaches. So, again, they continue to expand the menu of items that they will try ketamine infusions for, and see if they're effective, and that list continues to grow. How is it used? There are several different dosage forms for ketamine. You can use it as an intramuscular injection, similar to a vaccine or other type shot, a sublingual troche, and that is basically a tablet that dissolves under your tongue. There is now an FDA approved nasal spray called it's S-ketamine is the drug name of it, but it was approved in 2020, I believe. And so again, that just kind of goes to show you the effectiveness of ketamine for depression, and specifically for depression, treatment-resistant depression, and has been used now for a couple of years. An intravenous therapy, which is what we use in the clinics, and what most of the studies honestly have been done on, is intravenous use of ketamine for these conditions. What studies show as far as effectiveness of treatment, intravenous is the most effective, as it is for most medications. Injection would be the second, followed by the nasal spray, followed by the sublingual tablets, rather. Sorry. The positive couple of pros and cons of these, the biggest one being with intravenous therapy or injections, that you don't have to use it every day. It's a induction series of 6 infusions, and then once or twice, or once a month, or once every other month for sort of maintenance therapy. Whereas the nasal spray or the sublingual, you do have to use them every day to be effective, and that can actually increase your risk of side effects from ketamine because you're actually, even though you may be using a little higher dose for that induction series, or when you come in once a month to get it, cumulatively speaking, there's a much higher amount of ketamine that you get over time by using the sublingual troches every day or the nasal spray every day. So that can increase your risk of some side effects, but just something to keep in mind. on that. So ketamine infusion therapy is mainly what I was going to cover today. Based on studies, we see that low doses of ketamine, usually about 25% of the dose that we use in anesthetic for surgical use, infused over about 1 to 4 hours, can improve many conditions that have not responded to standard therapies. Really what we try to do with patients is try to relax them and create a biodisassociation, not full anesthesia. So we're not trying to put patients to sleep fully. We're actually trying to just create a sort of a waking dream is really the term you hear used a lot when we talk about ketamine infusion therapy. And typically the nurse will come in and check on a patient every 5 to 10 minutes, looking at vitals, monitoring the patient, making sure everything is good. We usually use an infusion of 1 hour for mental health, for depression or PTSD, and a infusion of 2 hours for pain. So we don't go, some clinics will go to 3 to 4 hours, but we found our patients really respond pretty well at 1 to 2 hours and have a much better experience in those shorter time frames than using the longer infusions. I don't want to get too deep into this, but I'll just run through it really quickly on how the mechanism, or that researchers believe the mechanism of ketamine works for depression patients and pain patients. Ketamine blocks a certain receptor in the body called NMDA receptors, and that allows the body to respond. There's a chemical in the body called glutamate, which is really responsible for some pain and inflammation and things in the body. So really about blocking those NMDA receptors, you get that glutamate surge in the brain, which, because those NMDA receptors will actually reuptake glutamate in the body, so you kind of leave some of that there, and that really causes what they call synaptogenesis and a reversal of the negative effects of chronic stress and depression. So synaptogenesis is actually the creation of new pathways in the brain, and that's what we do with that induction series, that series of 6 infusions, and then we're really creating or training the brain to operate in a manner that works around the trauma or works around the pain, the neuropathic pain that it's experiencing. So it finds new ways to communicate with the body that reduce the amount of anxiety, of PTSD, of depression, because it finds a new way to function with the help of the ketamine infusion, and basically helps your brain look at things in a different way and find new pathways. And that's really sort of the theory of the mechanism of action there. It's hard, of course, to definitively prove that that's what's happening, but taking MRIs before and after patients use ketamine, they have been able to sort of determine likely mechanisms, and that's really kind of how they think it really works within the brain. Got a short video here. It's only about 2 or 3 minutes, but it's a good description of a patient who has just undergone ketamine infusion therapy and what she experienced and her experience with it. So it's useful, I always think, to hear from patients. So let me just play this really quickly.
It looks like a spa.
Alexa, play meditation music.
A place Rachel Bush has gone to unwind. But this procedure, where Rachel is being treated for PTSD, depression, and anxiety with an injection of ketamine.
The past few months were rough.
After an assault that nearly killed her, she was prescribed antidepressants that just didn't work.
I was contemplating suicide, wishing that I had been finished off.
Then someone told her about Dr. Quan Henderson, owner of Mindscape Ketamine and Infusion Therapy.
It helps kind of remodel the brain, the way it feels about certain things.
Ketamine affects your brain's neurotransmitter called glutamate. You can liken it to how Zoloft affects the neurotransmitter serotonin. Ketamine often gets a bad rap because of its history with people abusing it. Its street name is Special K, but it's been used in medicine for decades.
Ketamine is an anesthetic that's been around for 50 years, but in the last 15 years it's actually been used for treatment of mood disorders that are resistant to certain medications.
Dr. Henderson opened this practice after ketamine helped his wife, Stacy, who'd battled depression for years.
I couldn't believe it. It was just such a wonderful, life-changing experience for me.
KHOU's mental health and wellness expert Bill Prasad warns ketamine has addictive properties, although it's on the lower end of the spectrum. He says ketamine should be used sparingly and hand in hand with therapy. The FDA has not approved injecting ketamine for mood disorders, but the VA hospital does use it to treat PTSD and reports positive and immediate outcomes.
This is a miracle medicine.
Rachel says it worked on day one for her and describes the experience like this.
It's almost like I'm slipping away into a good dream. And things just start to make sense. Something changes. You see that you're not in crisis mode. You see the light.
Dr. Henderson says the effects can last months to years, depending on the person.
In my opinion, it's a cure for depression and PTSD.
So again, that was a typical typical patient that we see. We hear those types of stories a lot. Again, ketamine, it doesn't work for everyone, unfortunately, but it does have a very high success rate. Most studies show anywhere between 70 to 80% of patients respond. It works very well for PTSD, upwards of 80%. Anxiety is around 50%, and treatment-resistant depression around 70%. So, really, when you compare it to other treatments out there, it really is on the a really remarkably high end of effectiveness. And the great thing, or really unique thing about ketamine therapy, specifically infusion therapy, is like the patient mentioned, how quickly it can work. Typically on those induction series, what we call these 6 1-hour infusions over 3 weeks. If a patient doesn't respond after 2 to 3 treatments, we will typically, advise that patient, you might not want to continue therapy at this point because it's probably not working. You're going to know if it works really quickly and whether or not you need to continue with the treatment, as opposed to some antidepressants that can take, 6 to 8 to 12 weeks to complete, to fully work. It is a pretty remarkable difference that way. So like the patient mentioned, though, you're going to get an induction series, 6 1-hour infusions over 3 weeks, and then you move to a maintenance schedule of 1 infusion per month or as needed. Typically, 1 month to 1 every other month is sort of where you get there. And we base this induction series, and the treatment, is based off of literature. It's an evidence-based approach. And when we look at evidence reported in the literature from single or multiple doses of ketamine, it's really that sustained response that we're trying to get. And you can see with the number of infusions, the response rate increases, as well as the length of the response increases. So that 6, this data point A here, is really where sort of that 6 infusion induction series comes from, is the effectiveness shown in a lot of the studies. We usually start patients out at about 0.5 milligram per kilogram. Again, it's weight-based, and we'll increase it to 1 to 1.5 milligram per kilogram based on the response. Some patients need a little more. Some patients can't tolerate that much, but we'll sort of, again, that's a very individualized approach as far as the dosing goes. The schedule for chronic pain is a little different with ketamine infusions. So with chronic pain, you're typically going to get a longer infusion. You'll get a 2-hour infusion as opposed to the 1-hour infusion for mental health. Most of the pain that really responds well to these types of treatment are neuropathic, which means they generate from the nervous system. Complex regional pain syndrome, fibromyalgia, persistent migraine headaches, and neuropathy are some of the common ones we see. Occasionally we'll get success with things like back pain if it has a large neuropathic component, or those sorts of things. But really it is more the neuropathic conditions, and the success rate with chronic pain is not as high as with the mental health conditions. But for patients who have tried everything else and are really looking to reduce opiate use or to just try to get an improved quality of life, it's probably worth a shot for those patients if they're not getting the relief that they're looking for. It can hurt. It can help with many things. You know, usually patients, if they're going to improve, they will improve for about 4 weeks. So we do have to retreat within, you know, again, that month, a month and a half. You get 3 2-hour infusions over 7 to 10 days as an induction series. If we get a good response there, they'll move to a maintenance schedule of 1 infusion every 1 to 3 months as needed. And again, 50 to 60% response rate in these for chronic pain, as opposed to 70 to 80 for the mental health. So it still works for the majority of patients, but it's just not not quite as high a percentage. So if you're interested, if ketamine therapy makes sense for you, or you've tried other things, or you know everything else, and you're really looking for another solution, the first thing you would do is contact a clinic like New Horizons Infusion clinics. Typically, what the schedule of a patient, the pathway will be, is you'll get an initial assessment from a mental health professional or medical professional, determining whether they think you would be a good candidate for ketamine infusion therapy. Will you then obtain your medical records for the physician to review? They'll take that assessment, they'll take your medical records, and then decide whether you would be appropriate for ketamine therapy. Once approved, they'll schedule your appointment. The day of your appointment, when you come in for the first, for any infusion, you're going to hold all the meds that you can. Obviously, if you're taking certain medications that you can't hold, it's not a deal breaker. We just ask that any medications that you can hold, you try to, especially things like benzodiazepines. Lamictal would be 2 examples that we really would like patients to hold, because they can interfere with the effect of the ketamine. And no food for, really, we say 4 hours, but it really, we try to ask patients not to eat or drink not to drink for 4 hours and not to eat for 12. And really, and bring your own music. We typically encourage our patients to bring their own music, to anything to help relax while you're undergoing the infusion. Again, we want patients to be relaxed. We want we really try to keep the infusion suites very quiet, so the patients can really focus on their own mental health during those infusions. And then after the infusion, the physician will observe the patient for 20 to 30 minutes to make sure there's no residual effects. And of course, no driving for 24 hours. That's probably the biggest inconvenience for patients, is that you can't drive home. We will require that you do have either a ride share or someone to take you home. So that's important to arrange as well. Side effects from ketamine therapy, nausea certainly is the number one side effect. We'll typically give patients medication with the infusions along with the ketamine to prevent the nausea from occurring. Again, that's why we ask that patients don't eat before the treatment. It may cause elevated blood pressure. That's something that you are hooked up to a patient monitor during the treatment. We do monitor blood pressure and oxygen saturation levels to make sure everything's all good with the patients during the treatment. If your blood pressure does increase, we do have medication that we give for that as well to control that during the infusion. Excessive sedation is something we try to avoid, but again, we do have medications that can counteract the ketamine to prevent that. And like I mentioned before, certain medications that are important to hold, especially Lamictal, benzodiazepine, thing like naloxone, can really hinder the effect of the ketamine and reduce its effectiveness. So we do ask the patients hold those at least on day of treatment. IV ketamine has a half-life only 5 minutes, so side effects resolve very quickly. So again, things like the elevated blood pressure, once we stop the infusion, it goes right back to normal. So really there's no, again, lingering effects of that. It's just during the treatment that we do have to monitor those sorts of things. If you do have very high blood pressure, that can be a contraindication to therapy, but that's something that the doctor will decide when they review your medical records and things like that. Unfortunately, the downside to ketamine infusion therapy is the cost, because it's not FDA approved for depression or chronic pain. Most insurances will not cover it. More and more are starting to, and we will help patients submit claims to their insurance to help get reimbursement for that. Slowly, things are starting to change on that. But for the most part, the majority of insurances will not cover it. So typically, the per infusion, the 1 hour treatments are $350, depending on the clinic. Our clinic is is $350 for actually it's $300 for the depression and PTSD. We lowered the price recently, and $450 for the 2-hour infusions for chronic pain. So 1 hour $300, the 2-hour chronic pain infusions are $450, and prices are on the website. But clinics can charge anywhere from $350 to $600. Other clinics $500 to $800 we've seen for the longer infusions. So it does pay you to kind of shop around on these clinics and check the prices, see what the individual prices are going to be before you commit on that, because it is for the most part a cash service that you may be able to get reimbursement from your insurance, but not always.
Turner, we had a question. If you want to take a look at,
sure.
and that is, well, first of all, Raymond made a good comment. He said, for our information, the VA in Tampa is not approved the use of ketamine, even though my civilian doctor has used it and said he had benefits from it. So thank you very much, Raymond, for that comment. That's very appreciated. Also, Stephanie has asked, I'm in pain management for chronic pain. How do I do this? Also have PTSD bad. So any comments on that, Turner?
Yeah. So, with that, again, that would be something that the doctor would look at. Pain management, opiate use is not a contraindication for ketamine. They work on different receptors. They're completely different medications. So there's not really any interaction between opiates and ketamine. So as far as that goes, we treat many pain management patients, honestly, for the mental health conditions. What we see really with most chronic pain patients is there is a very strong mental health component to it, and and really just improving someone's mental health can actually improve their overall pain profile. So that it's not it does not preclude it, but it is something the doctor would have to look at the records and kind of make his decision on that. I got these pulled. I kind of pulled these up here, but next one is, are the infusions indefinite? It depends on the patient. Some patients are really able to stop the infusions after the induction series and maybe 1 or 2 months of maintenance. But for most patients, every couple of months, and it can be from every 2 months to 3 months to some patients come in every 6 months. It's really just how, based on how you respond, how you're feeling. If those patients are having some symptoms come back, then they'll give us a call and say, hey, I think it may be worth me coming in to get another infusion. But it's really not. There's no set schedule with that, and it's really very dependent on how patients respond.
Had a great comment.
I was just reading this. Yeah, so here we have a patient again that's tried a lot of different things, has PTSD, has depression, cyclic depression, hypomanic. That's very very normal with the patients we see. The lozenges and nasal spray, they help. They could very well help with that. The insomnia and the pain. It's possible. I'm not sure about the nasal spray. They're not, again, that's not FDA approved for pain use. The lozenges, some clinics may use those for chronic pain. We don't personally, we don't ourselves use the oral lozenges at our clinic. We just do the infusion. So I don't have a lot of personal experience with that, but I know it makes sense from a pharmacologic perspective. If the infusion will help, then using the troches or the lozenges may help as well. So that's not something that has a lot of information on it, again, because the oral use of it is fairly new within the last couple of years. So there's not a lot of data out there on it, but again, it may be something that's worth a shot. Everything works better if you use it in conjunction with therapy, talk therapy on that. So again, that's a caveat as well. So. I don't think we had. So this is a specific condition, adhesive arachnoiditis. Yeah. No, I'm quite sure we haven't seen one of those particular patients, but we have used it in some other, a lot of inflammatory conditions, neck pain, some chronic back conditions. But again, if it's a physical condition like that, it could help lessen the pain, but I'm not sure it's going to resolve it for you on that. It's hard to say for sure, but outcomes again are more positive with more neuropathic type conditions. So
I think things are so new. There's just not a lot of research in that area. Is that the best way to put it?
it's not. So again, these are there's some specific things that have been studied a lot with ketamine, and there's some that have not. With ketamine infusion, there's been a lot of work done with mental health conditions. Not as much work was done with the pain conditions. So we're still learning on a lot of this stuff. But for again, there has been work done, and we do have some good data sets on certain things. But a lot of it is just hey, if you tried everything else, we know that ketamine can help with certain pain conditions. It may be worth giving it a shot or talking to the doctor and seeing what their opinion is on it. So
there's just on that particular note, I was just looking under Google. There was a study that was put out August 24th that was literally just printed about how ketamine can provide pain relief for this particular condition. And it's a study. Again, I'm not saying it's
yeah, no, exactly. That's I think a lot of researchers have really latched on to ketamine as a new alternative or new potential treatment for a lot of different things. So there is a lot of work being done on ketamine in general. So as well as some other psychedelic type treatments out there too. I think we're going to see a lot of new options in the next few years as far as whether it be psilocybin or other types of psychedelics in conjunction with ketamine for these treatment-resistant mental health conditions, especially. So
yeah, I just
there's just a lot
I put the link in.
There's just a lot we're learning. Yeah. Oh, okay, great. Yeah, there's just a lot we're learning about the way these drugs work that's new, so trying to take advantage of that really is what researchers are trying to do.
Sure.
So
Lisa had a question about treatment help with spinal stenosis.
Yeah, I mean, it definitely will help with the pain. Almost all patients that we have treated for those types of things have seen an improvement in their pain symptoms. Now, how long that improvement lasts varies from patient to patient. I know we have one I'm thinking of off the top of my head that got relief for about 3 months and then had to come back and get another infusion. But that's according to her, comparing to what she was experiencing, she's perfectly happy coming back every 3 months and getting those infusions to get the quality of life improvement there. So, again, it's every patient is a little different, but it's if you tried everything else and you're still looking for better results, again, it's worth a conversation with one of the physicians probably to see if you're a good candidate. Some high points on our clinics, and really I think I like to do this because I think any clinic you look for, whether it's New Horizons or if you're not in the area, whether it's another clinic, you want to make sure it's physician supervised or at least very qualified secondary providers. A lot of ARNPs will do these infusions, which they're very qualified to do. As long as they've got experience doing that in the past, or it's just something you want to make sure your provider is experienced doing. It's not a highly intensive medical experience. It's just a matter of the patient of the provider having experience doing these types of infusions and what to expect with the patient. So just ask those questions. How many infusions have you done? What's your background? Those sorts of things. Therapist on staff. Whether that someone to help you along the way and help you after the infusions. We certainly will refer patients who don't have a therapist or who don't have a psychiatrist. But it is important to really have that follow-up treatment after to get the maximum results. So, that's something to look for as well. And then follow-up again, we have, with our software, you can do pain scales or mood scales as you go along. And that can also help you judge if it's about time for a maintenance infusion, after that induction series to sort of to judge how you're doing as well. So those sorts of things are important. You don't just want to go in, get the infusion and never have any interaction with the provider again. I think it's really better if they work with your medical team, work with you on an ongoing basis, and we really strive to do that with New Horizon. Again, we'll wrap it up there. Again, I thank you for your time and attention. Again, the two clinics that we have in Tallahassee and St. Petersburg, we've done several hundred patients at this point, had some really good results. So we really, I urge you, if you think it's a good alternative for you, to have that conversation with the provider and see if it works for you.
Turner, you can have, somebody can give you a call. Go back to the last slide. Somebody can give you a call if they're thinking about this, and you can have a conversation about it, and that's free, isn't it?
Exactly. Yeah. No, there's no commitment. There's no cost. It's you can speak to the provider. You can have those initial consultations are completely free. So it is, if it's something you're interested in doing, you can have that done, and at no commitment or cost. So it's worth more investigation if you think it'll be good.
Yeah, because I think you're as concerned about making sure that it works as the patient themselves.
No, absolutely. I mean, that's, we don't want anyone to have a disappointing experience or a negative experience. And so we really do strive to, properly vet patients for their own health as much as see if they're appropriate. So
Sure. And you've had, you've been at this, I know, for a while. You've had some success with it. And I think it's important that people realize that it's like any other holistic approach. What you're trying to do is you're trying to do some things that really have shown success. And we're trying to figure out not only how to duplicate that, but also how to do more research so that we can actually take on more challenges and be able to provide better solutions. That's safe to say?
Exactly.
Yeah.
No, that's very well said. Yeah, that's exactly right.
We have one.
There's.
Go ahead. I'm sorry.
I was just going to say, I went to a meeting a while ago, and one of the psychiatrists, was there saying, patient experience with psychiatrist medications. You come in, they see the psychiatrist for 5 minutes, they kind of rearrange the same medications over and over again, and so really what we're trying to do is just, provide another alternative, and I think you're going to see a lot of that in the next few years is trying to use these alternative therapies, to augment what we already have available, but, it's still limited. There's only so many things you can use to treat depression. You use SSRIs or some combination of those things, or anti-anxiety medications. So hopefully we can move the ball down the road and get some other treatments that may be a little longer lasting, a little more effective. So
move the needle for a change. We had one question from an anonymous attendee, and probably came in a little bit late. What's the difference between the spray and the infusion as far as the effect? Yeah,
so the spray is definitely less effective than the infusion. Studies it was almost neutral with the nasal spray. It was, just enough over the bar for the FDA to say, yes, it works. Again, the bioavailability of ketamine, it was designed to be an injectable drug. So it is much lower with the nasal spray. It's higher with the nasal spray than it is with the oral. But the results have been mixed with the FDA approved nasal spray when compared to the infusions. Now, the advantage is that it is FDA approved, that insurances, although they will require prior authorizations and a lot of hoops to jump through, they will often cover the nasal spray where they won't cover the infusions. So it may be a good starting point for some people. But the actual effectiveness, there's not, the infusions have been shown to be much more effective, not by the FDA, but by these other studies and these other peer-reviewed articles out there. So that's sort of why we focus on that. If somebody's going to go down this road of ketamine, we want them to have the best chance of success. And the nasal spray will typically it really works best with talk therapy. So really the sort of the idea behind the nasal spray is you use the nasal spray and then, during a therapy session to make the therapy session more effective, essentially. So as a standalone, it has mixed results without the talk therapy.
Well, Turner and everyone, Turner, thank you very much for the information. And if there's any other questions, please bring them forward. But I'd like to thank everybody for joining us tonight. I know that I've learned a little bit about ketamine, and I think it's something that's really, It's not really on the cutting edge, but it is new. But it is something that is very effective. And I know that in many cases, keeping, beating your head against the wall for a particular treatment that's not working may not be the answer. You may want to take a look at other answers like ketamine as a potential, because I think you've seen some great success with it. With some patients that were in some pretty desperate situations. Is that right to say?
Absolutely. Absolutely. Yep. Absolutely.
So,
well, thank you, everyone. And thank you, Mark, for having me here. So.
Great. Well, thank you, everyone. And I want to put a plug next week. Our medical marijuana series kicks off with the marijuana side. We have medical marijuana 101, the basics, as well as terminology, and we'll be handing out some material on medical marijuana definitions and actually digging down into how it works. So please join us. And thank you very much. And everybody, have a great weekend. Thank you.